Hello, my name is Jacquelyn Reilly, and today I'm going to be discussing Fragile X syndrome, or FXS. The topics that are going to be covered in this presentation include a brief description of FXS, including the causes, characteristics, prevalence, and diagnosis of FXS, as well as interventions, supports, and services for students with FXS. To start, let's discuss Fragile X syndrome. The Centers for Disease Control and Prevention, or CDC, states that Fragile X syndrome is a genetic disorder. FXS is caused by changes in a gene that scientists called the Fragile X mental retardation 1 gene, or FMR1, when it was first discovered. The FMR1 gene usually makes a protein called Fragile X mental retardation protein, or FMRP. FMRP is needed for normal brain development. People who have FXS do not make this protein. The Genetics Home Reference Site, which is powered by the U.S. National Library of Medicine, explains that FXS causes a range of developmental problems, including learning disabilities and cognitive impairment. By age 2, affected individuals usually have delayed development of speech and language. Other health impairments and disorders experienced by individuals diagnosed with FXS include anxiety and hyperactive behavior, such as fidgeting or impulsive actions, and attention deficit disorder, or ADD, which includes an impaired ability to maintain attention and difficulty focusing on specific tasks. Additionally, about 1/3 of individuals with FXS have features of autism spectrum disorder that affect communication and social interaction. The National Fragile X Foundation also mentions that in males, hand biting or flapping, poor eye contact, sensory disorders, and increased risk for aggression is common. In addition to the behavioral characteristics of FXS, most males and about half of females with Fragile X syndrome have characteristic physical features that become more apparent with age. These features include a long and narrow face, large ears, a prominent jaw and forehead, unusually flexible fingers, and flat feet. The CDC reports that the exact number of people who have FXS is unknown, but a review of research studies estimated that about 1 in 7,000 males and about 1 in 11,000 females have been diagnosed with FXS. Genetics Home Reference breaks down the experiences between males and females diagnosed with FXS further, explaining that most males with Fragile X syndrome have mild to moderate intellectual disability, while about 1/3 of affected females are intellectually disabled. Seizures also occur in about 15% of males and about 5% of females with Fragile X syndrome. The National Fragile X Foundation explains that with the identification of the FMR1 gene that causes FXS in the 1990s, accurate DNA testing became available. The FMR1 DNA test, sometimes called the Fragile X DNA test, is now the standard of care for determining the presence of Fragile X. DNA testing detects more than 99% of individuals, both males and females, with FXS, as well as Fragile X carriers. Now that you have been introduced to Fragile X syndrome, as an educator, it might be helpful to be able to identify some signs and symptoms of this disorder. The following signs offered by the CDC indicate that a child might have FXS. Developmental delays, such as not sitting, walking, or talking at the same time as other children the same age. Learning disabilities, including trouble learning new skills. And social and behavior problems, such as not making eye contact, anxiety, trouble paying attention, hand flapping, acting and speaking without thinking, and being very active. If you have a student with Fragile X syndrome in your classroom, there are many interventions and supports the student will need to have access to the curriculum. We will explore some of these interventions and supports next. The Fragile X Clinical and Research Consortium on Clinical Practices mentions that individuals with Fragile X syndrome frequently have sensory processing and sensory integration problems. The terms sensory integration and sensory processing are used to refer to the theory that describes a range of difficulties seen in many neurodevelopmental disorders. The Fragile X Clinical and Research Consortium on Clinical Practices explains that students with FXS may encounter the following sensory difficulties and impairments: the visual system, difficulty tolerating bright lights, difficulty making good eye contact when looking at people, difficulty looking at written materials for long periods of time. With the auditory system, they may experience difficulty tolerating loud noises, such as the vacuum cleaner, and difficulty tolerating noisy places, such as a mall, a restaurant, or a movie theater. In regards to touch, people with FXS may have trouble tolerating certain clothes, difficulty tolerating light touch, difficulty working with writing utensils or art materials such as finger paint, and difficulty tolerating touch or feeling of grooming activities. It is also noted that sensory integration and sensory processing issues in those with FXS typically are a significant contributor to delayed skill acquisition and to challenging behavior. How can you as an educator best support the sensory needs of students with FXS? General education guidelines for students with Fragile X syndrome are also highlighted by the Fragile X Clinical and Research Consortium on Clinical Practices. Some of their suggestions are as follows. Avoid forcing eye contact or giving look at me prompts. Gaze avoidance for individuals with FXS serves as a protective behavior. Recognizing this will allow both the educator as well as the student to engage socially, decreasing outbursts and flight behavior due to hyperarousal. Many students with FXS increase and initiate eye contact when they are comfortable with staff, so allow for opportunities by being available and by not forcing the eye contact. Next, consider distractibility and anxiety issues when arranging seating for the student. So avoid the middle of a group, seat the student away from doorways and AC or heating vents. Next, infuse a sensory diet developed with an occupational therapist into the student's day to address the sensory processing issues. Also, you can simplify visually presented materials to reduce excessively distracting and overstimulating. Next, you can use reinforcements such as high fives rather than hugs or pats on the back. Finally, you can use high and low technological adaptations such as word tiles, sticky notes, and the computer for writing assignments. To account for the potential learning disabilities and cognitive impairment students with FXS face, the following strategies are provided. Use small group or one-to-one instruction when teaching novel tasks. This pre-teaching activity can greatly increase the long-term success for the child in the general classroom environment. Give ample time for processing and alternative methods of responding. Utilize close or fill-in techniques for assessments to help facilitate executive function skills. This is where certain words from the text are removed and the participant is asked to replace the missing words. Finally, use backward chaining. Ask the student to finish the task after you begin it. To account for the possibility that a student with FXS may also exhibit other health impairments and disorders such as anxiety, ADD, or autism spectrum disorder, the following strategies are to help with behaviors common amongst these diagnoses. To the degree possible, provide a calm and quiet classroom environment with built-in breaks and a predictable daily routine. Teach the student to request a break and provide a safe refuge area. Provide a visual schedule or transitional object or task to promote transitions. Use manipulatives, visual material paired with auditory input, videos, and models. Provide social skills, lessons, and social stories, and engage typical peers to model appropriate behaviors, and also provide completion or closure for activities and lessons. Finally, assistive technology is also a valuable tool for a student with FXS to have access to in the classroom. The Fragile X Clinical and Research Consortium on Clinical Practices General Education Guidelines for Students with Fragile X Syndrome mentions that assistive tech may include modified mice or keyboards and touch screens. These can be used to interface with technologies for educational purposes and to reduce motor demands, thus reducing limitations for motor deficits and allowing responses more reflective of the ability of the individual with FXS. So easily put, assistive technology helps your students show what they know. I hope this presentation gives you a general understanding of Fragile X syndrome, as well as some practical supports, interventions, and tools that you could use in your classroom to help support a student with FXS. This slide is a list of references used in the making of this presentation.